So we're gonna do the skill checkup of the musculoskeleton. So we're first gonna introduce ourselves, provide privacy, close the door, hand hygiene, assemble the equipment, and then you would ask the patient, can you tell me your name and date of birth? And they'll tell you. Sully, I don't know his last name. And then you would explain why you're here, and it's because of we're gonna do a health assessment of the musculoskeletal. And then we're gonna ask 2 questions. Do you have any pain anywhere or any swelling? No? Okay. So we're first gonna start off with the jaw, the TMJ. So that would be here. And we would just ask the patient for some range of motion, which you'd go like up and down and hear any crackling, like left and right, like that. And you would inspect the area. You would also palpate the area. So once you tested the range of motion, inspection, palpation, you're gonna go down to the shoulders. So we're gonna inspect the shoulders. We're gonna palpate the shoulders. Range of motion, you would just ask them to like go up, circle, and when we're testing for the strength, you will push down on the shoulders and ask them if they can push up. So try to push up and they would try. So next we are gonna head down to the elbow. Again, we're gonna inspect the elbow. Good. Next we'll palpate it. We're gonna do range of motion. So that would be like that, like that. And then testing the strength is you would ask them to go like this and you would pull on them. You'll pull this way and ask them to pull the other way, the opposite. And that's how you test the strength. And then we will go to the wrist and inspect the wrist, palpate, and because there's a lot of bones there. And then you would ask them to go like this, maybe like that. And maybe while you're there, you can ask them for the Fallon test, which they have to put their hands just like this for a minute and not feel any tingling sensation. And the Tinel test is you will go like this on the median nerve and make sure they don't feel any tingling right here or the index finger. So after that, you perform range of motion. Strength, you would maybe like, when they go like that, maybe push on them. Ask them to go like that, and you can push and have them push the opposite way. Next, we will do the hands. So same, palpate all the carpals, bones, inspect it. And yeah, same range of motion, just like that. Maybe ask them to go like this, together and apart. Look at their fingers. Next, we are going to do the hips. So with the hips, we would ask the patient to lie down, and we would ask them to extend their leg this way, bilaterally. So, and then ask them to go the other way. Make them go up and up. Next, you obviously are inspecting the left and the right. We're also palpating, and we tested their range of motion, and we can test their strength by pulling it this way and ask them to go the opposite. So you're pushing this way and they're pushing this way. And same thing with this one. They want to push inward, but you're pushing outward, so the opposite. And then we're gonna go on the knees, and we're gonna inspect the knees. We're gonna palpate the knees and ask if there's any stiffness or joint. So these, you would ask them to go like this, like you would ask them to fold their leg like this. Maybe I can show you better. Like this. And again, while they're doing this, you can push forward while you ask them to push inward, and that's how you test strength. And again, this one's harder to do with the stuffed animal, but you can test their range of motion by flexing like that. They can sit up on the desk and maybe have them do that. Go like that with their leg straight up and then straight down. And then we're going to go on the ankles. We're going to inspect the ankles, palpate the ankles, test the range of motion with make their ankle go like this, up and down, and maybe push. Tell them to push up while you're pushing down. So it'll go like that. And you'll test the other leg as well. You know, have them push at the opposite, like you're pushing this way and they're pushing that way. And then we're gonna do the feet. So we're gonna inspect the feet, make sure they're the same. We're gonna palpate it. And then we're gonna test their range of motion. So make them go like that. Flexion, extension, like that. And maybe, again, push down while have them push up. Push down while have them push up. Make them go inward like this. And then outward. Just so you're testing their range of motion. And they're tested their strength. We palpated and we inspected them. Next, hand hygienes after touching the feet. We're going to look at their spine. So their thoracic spine should be curvature. And then you will inspect it. You will palpate it. And testing the range of motion, you're just going to ask them to like bend. And you should be able to see that C curve. So if they bend, be like this. Palpate it. And range of motion would be having them be still, but making them go like this and this without turning their hips. So like that and like that. Next, we are gonna do the neck. So for the neck, we are gonna inspect the neck, palpate it. We're gonna note the skin color. So we're palpating on the neck. So range of motion is probably like up, down, left, right. Strength, maybe ask them turn to the right, to turn to their left while you hold do the opposite side, so like that, you know. So we'll do both ways, and then that's how we tested muscle strength, by going like that and like that, up, down. We palpated. We noted for skin color, any swelling, anything abnormal. And then that's it. We'll discuss all the findings with the patient and ask them and tell them we didn't find anything abnormal. Do you have any questions about the assessment? They'll say no. Wash hands, and that's it.